Video platforms like Zoom have become our new normal, but if you're not turning that video function off, it's also causing people to pay even more attention to their looks. So if you're considering a cosmetic change, you might want to listen up.
The pandemic has had a surprising effect, an increase in cosmetic procedures. From tummy tucks to breast augmentations, cosmetic surgeries are in high demand. A new study out of Vanderbilt University found that out of 342 board-certified cosmetic surgeons, nearly 10% were not trained to do surgery at all. Over 60% advertised operations beyond their education, including liposuction and butt lifts. Many people believe the term board-certified equals safe, but this is not always the case. So how can you find a qualified plastic surgeon? And what are the real risks of seeing a doctor practicing beyond their scope of training?
Now, anytime you get a surgery, there are risks, but you can do your part in choosing the best doctor for yourself. Joining me now to weigh in on this subject is our friend, Dr. Andrew Ordon. Hey, Dr. O, what's up, man?
How are you, Dr. Ian? Good to see you again.
Good. Hey, listen, Drew, we're going to be really clear about this. I think this is a very, very important segment, so I want to speak very clear to people. Number one, what is the difference between a cosmetic surgeon and a plastic surgeon?
Plastic does not equal cosmetic. Yes, plastic surgeons, board-certified plastic surgeons like myself are trained and do cosmetic surgery, but any doctor can call himself, quote, a cosmetic surgeon. So he does cosmetic surgery without having gone through, in my case, 8 years of residency training, and there's a huge, huge difference there.
Okay, Drew, so let me ask you this question. I'm just going to make this scenario up. If you're an ER doctor and you decide that you want to do cosmetic surgical procedures, can you do it?
Well, legally you can do it, and this is why, because you can call yourself whatever you want to do. You can go to one of these weekend meetings and be trained in doing fillers or lasers or whatever, and then call yourself a cosmetic surgeon. You used ER as an example, but family practitioners, I saw a radiologist who started doing liposuction, and the list goes on, and consumer really has to be aware of that, because we need to nip this in the bud now before you get into trouble. Why is the training so long? Well, you can learn to do the procedures, but if things don't go right, that's where a lot of the training goes into, and experience is staying out of trouble. But if there is an issue, because complications can happen, you know how to address those and take care of them. And I think that's what makes the difference. You want somebody who has been trained to the nth degree that knows how to do it. But even that being said, you want to go to a plastic surgeon that is doing the procedure you're looking for on a regular basis. Now, as a caveat, there are certain specialties, ophthalmologists are trained to do cosmetic work around the eyes, ear, nose, and throat, are trained to do cosmetic work on the head and neck. But when you venture out of your scope of practice, when you venture out of the anatomic area that you're trained in, that's where trouble starts.